Hi everyone, Dr. Martin is here from Pulse-Light Clinic. Today I'm going to talk to you regarding the difference between ablative and non-ablative lasers. Generally speaking, lasers can be broadly categorized as in two broad categories, which is ablative and non-ablative. Usually ablative lasers, they target the water in the skin as a chromophore and vaporize and heat the tissue at the same time, versus non-ablative, which is only heating the tissue and is not removing or vaporizing any tissues. So ablative lasers are generally for skin resurfacing, fine line and wrinkles, scar removal, lesions removal, while the non-ablative lasers are for more rejuvenating, again, fine line and wrinkles, pigmentations, and removing the aging spots and so on. Generally, yes, ablative lasers are much more stronger. They're removing part of the tissue. Obviously, in that as well, we can have a fractionated laser, fractional laser, and full ablative laser, which full ablative is very minimally used, is when we have a skin lesion or something that we need to remove completely, or in a very specific cases to do the full face ablative laser, for example, for rejuvenation and removing the fine line and wrinkles. At the same time, downtime, these two, because of what I just explained, is a bit different. So the downtime for ablative laser is about 7 to 10 days, while the downtime for the non-ablative laser is much less, is about 3 to 5 days. We get the complete healing. If I give you an example of what ablative laser, such as CO2 lasers are ablative, although we use it more on like a fractional laser. Asclepion or cool laser that we have, those are ablative as well. Non-ablative like a Pico, like a LaserMD, those that we work like a Candela, which is, it heats the tissue, promotes collagen, promotes healing, removes the pigments, target the inks and the melanin in the skin, while the ablative ones remove the tissue as well because they target water. And also ablative lasers can be used as I mentioned, full ablative or fractionated. Within fractionated, we just remove or vaporize a fraction or a portion of the skin, which that promotes faster healing, and it is the new method of delivering the ablative laser to the skin. So that was in a very brief explanation of these ablative versus non-ablative lasers. So if you have more questions, or if you want to see if you're suitable for any of these treatments, please come and see me. Thank you.